Dr. Robin Murphy, and I'm a naturopathic doctor at Conceive Health. And I really focus my practice to support men and women with fertility and their reproductive health, particularly looking at their microbiome, looking at hormonal balances in their genetics to understand the underlying facets that can contribute to infertility. Well, the microbiome is really a collection of bacteria within the body, and it's very unique depending on where in the body you look at that microbiome fingerprint. So there are different communities of bacteria within your ear, nose, and throat, even differences within each ear depending on which side of your head that you use your phone. We also find that there's bacteria within the digestive system, stomach, small intestine, large intestine, on the skin, as well as the reproductive organs. And it was normally thought that the upper reproductive organs were actually sterile, but now we realize that the fallopian tubes, ovaries, and endometrium actually have a microbiome of their own. Well, it's really the macro environment as well as the microenvironment. So the microenvironment includes the actual environment that the bacteria are in. What is the acidity level? What is the blood flow, the oxygen level, the micronutrients? And then on a macro scale, we look at things like diet, lifestyle, stress, hormonal balances, chronic infections and inflammation. All of these can affect your microbiome. So there can be local symptoms, say within the digestive system itself, such as chronic bloating, gas, changes with your stool. We can see systemic symptoms such as skin rash, acne, also changes within your appetite, difficulty losing weight, and also within reproductive health. So looking at signs and symptoms like chronic urinary tract infections, bacterial vaginosis, as well as chronic yeast infections that just seem to keep coming back. The microbiome, and particularly the vaginal microbiome and the uterine microbiome, affects reproductive health. It influences the environment within the uterine cavity, and this influences how the embryo implants. What's interesting and what we're seeing in clinic is that women who have a history of UTI or recurrent bacterial vaginosis or other infections, they have lower levels of this healthy lactobacillus within the uterine cavity or the endometrial lining. And these women also have a recurrence of pregnancy loss. And when we provide probiotics and get rid of some of that pathogenic bacteria that's causing a lot of changes within the environment, we find that these women can improve their reproductive outcome. The microbiome also has other influences on reproductive health. It influences the vaginal environment and their survivability of the sperm, even the ability for the sperm to swim up the vaginal cavity to the fallopian tubes. It influences the reaction that the sperm and the egg have to help with fertilization, as well as the implantation. So what we're finding is the microbiome has a huge influence on fertility in every step of the way. So assessing your microbiome, especially if you've had a history of recurrent infections, UTI, bacterial vaginosis, candidiasis or yeast infections, it's really important to come to the clinic and get an assessment and see, could this be contributing to your reproductive health? And then there's ways that we can support the microbiome through supplementation, through dietary changes, and helping to improve the overall vaginal and uterine environment through different treatment strategies.